The underlying reason why the African Child Trust exists is a vision to help widows and orphans. And in doing so, if we break those down to missions, then those are the three natural missions that come through in a holistic way. That is, trying to do what we can for disadvantaged children, helping their widowed mothers, their guardians, their grandmothers, or whoever the carers are, to continue to be able to maintain these kids in their home. And thirdly, if we are beginning to work in a mass way in a community where we're supporting more than 20, 30 children, they're going to schools. They're in places that they are attending schools in places where other children like them also exist. Our aim is to help those schools where we can, to have programs that will help to improve the quality of life. In working with communities, high on our agenda is education, sanitation and health, in addition to the welfare. So in terms of the education, we would work with a local school to improve quality of education, even when it's not, well, in addition to academics, but probably even in extracurricular activities. In the area of sanitation and health, we want to ensure that children are in an environment where they go back home healthy and not the other way around. And this could be issues such as toilets, issues such as having pipe run or having water to clean. These are very, very important issues that we wish to help communities to improve upon. In Nigeria, the exact numbers of children we supported is 267 across the southwestern part of Nigeria in itself. But in addition to these 267 who have received our full educational and welfare scholarship, we have also supported about 400 children who, from the point of view of welfare support, so providing them with food, clothing, and things that would enable them to live comfortably.
Àwọn ọmọ mi méjì wà lọ́dọ̀ mi. Ìyá àti bàbá kò sí láyé mọ́. Nígbà tí 2013 tí AC ti bẹ̀rẹ̀ ìrànlọ́wọ́ fún wọn, wọ́n ń ṣèrànlọ́wọ́ fún wọn lórí iléèwé wọn, lórí health wọn. Èyí tí ó jẹ́ àgbà Láìdé Olóyèdé, ó ní problem nípa eggs. Àwọn AC ti dìde ìrànlọ́wọ́ fún wa débi tó yẹ pé wọ́n ní kí n máa mú lọ sí ilé ìwòsàn fún ìtọ́jú. Àwọn náà ṣe ìrànlọ́wọ́ owó tí mo fi mú lọ lóṣooṣù.
My mother died because she was ill. She was very, very sick and there was no money to take care of her on time. And after her death, that was when I came across ACT. So, and since then, they have been helping me in my academic, in my home, and they have been supporting me in school, even giving me word of encouragement. And since then, in school, I've been doing very well. Instead of me thinking about her and the situation of my family, I've been able to focus on my study, even to eat well and also to dress well. They have been a help to me since then till now.
Ever since we returned from the village, it's been hardship. To feed in a day was like begging for food in the streets. And ever since I've learned to know ACT, they've been of help in terms of accommodation, foodstuffs, and even in my school and my welfare.
My story and how ACT helped me and my twins boys when I was passed through the challenges of accommodation. My children in the school about to write their WAEC, no help. And when my husband left home to work, did not return for 6 years. Now I became a father and a mother to them with the 4 children. The time came that there was no way. I ran to ACT. They helped me with some money. Then I used it to pay for their WAEC, to write the WAEC, because education is very, very important.
Our goal is to increase the number of children we support, disadvantaged children we support in the Ayobo Ipaja community to 200 within the next 12 to 18 months. It is our target, and this is where we're seeking as much support as we can. There are many orphans.
Generally, most of the children on this program, when looking through their performances, then yes, they did well. And I feel that if they are given the opportunity to continue, they are going to perform better. And at the same time to be able to get something reasonable out of them. Some of them achieving their goals for life. So I feel happy that we can have people who are so spirited, concerned about the welfare of the less privileged children in our world today, and they can go all out to help such children. It's a great thing, it's wonderful, because without this kind of facility, this kind of arrangement, some of them will be dropouts, and whereas they could be potentials, future professionals, future engineers, lawyers, and even president of the nation, that if they don't come across this kind of an organization, they may become dropouts, and their God-given gifts and talents will be lost.
With our desire to increase the number of children we support in the next 12 months to 18 months to about 200, we're looking for people, we're seeking people who, because of their compassion, would want to help one or more of these disadvantaged children. With 10,000 naira a month, it goes a very, very long way to bringing about a change in the conditions and in the lives of these children. Well, the 10,000 naira a month will provide a food pack, for them a month, which is one of the biggest needs to ensure that these children are fed throughout that month. We would also use some of it to support their school clothing needs, school uniform, school shoes, satchels, especially the youngsters who are in the secondary school and in the more senior section of the secondary school, in the senior school. They're growing constantly, and clothing that they have at the beginning of the first term are no longer adequate by the third term. So those are some of the things we use the money for. But very importantly, not to be underplayed, is the fact that we're also needing money for the health care. There is not a social health service within the community. And so if a child is ill and requires particular specialist help, they just cannot afford it. And we've had cases of those where it has required intervention at our level from the UK to provide the specialist care. So a cumulative use of the funds helps us to do all of these things.